Dr. Tracy, and I wanted to respond to this comment on the video I made about what does the scientific evidence show about toilet training and what is my expert opinion after 20 years. So I wanted to bring up a few points. It's not so much about the information to do with toilet training. It's about that a lot of people are kind of approaching scientific method and scientific data and expert advice this way. So what this person is doing is taking the evidence where I said that it showed 27 months was an ideal time to potty train and give you the anecdotal evidence of, well, my child was 24 months and it was cake. So I think that taking expert advice and then automatically giving anecdotal report to try to have some aha moment, I think is really detrimental because it really doesn't mean anything. So anecdotal reports can say lots of different things. Scientific evidence is giving you a consensus, right? So it's giving you what are the majority of people so that we can make recommendations to everyone. Individual recommendations are really different than general recommendations to the public. The next thing I would say is that be really careful when you try to compare geographic areas to each other, again, in some aha moment. There are cultural, socioeconomic, social aspects to when things happen medically. So there were a few studies that talked about how disposable diapers do delay when families decide to potty train. But it did not show any correlation with when a child was neurologically ready to potty train. So again, you have to take geographical, socioeconomic, social, cultural issues is different than science, right? And so they're important, but one does not negate the other. So I think it's an interesting topic. Why? Why are children in the US and Canada more likely to potty train later? And there is some decent evidence to suggest that it does have to do with disposable diapers, but not from some nefarious because Pampers is funding research saying that children aren't ready by then. Because parents don't come in my office and ask, when are children neurologically ready to potty train? And I'm not going to start until then. It's reporting what we already see. So disposable diapers do likely contribute to children potty training later because they're convenient. And so if you're using reusable diapers, you're already doing a lot of the laundry, you are already doing a lot of the mess up and cleanup. And if you're doing something like elimination communication, you have already been picking up on your children's cues and putting them on a toilet from birth. And so they are more likely to be parental instituted potty training, right? Which can work. It's not that it doesn't work. It's that the studies didn't show that children were neurologically ready until 27 months. So again, it's not so much about potty training. It's just about the fact that people come back to scientific evidence with anecdotal data, thinking that that is going to be some aha moment, and it just causes more distrust in the medical system. The second thing is, be careful when you are looking at geographical differences, is that is bad or good. It is interesting, right? It's interesting. I wonder why. There's lots of geographic differences, right? There are some cultures that don't use any form of any diapers at all, reusable or not. Are they going to have earlier toilet training? Yes, they're going to. It's just an interesting concept. The third part is to make sure that you are not constantly seeing every bit of scientific research as somehow being funded by some nefarious company that's trying to control you. It's really not there. And all you have to do is do a quick Google search to look at the study from Children's Hospital of Philadelphia. They have to disclose who funded their research, and it was the Children's Hospital of Philadelphia. Not very funded research article. This is truly just researchers who are trying to get more data to help families. So again, be really careful with anecdotal data. Be really careful with geographical differences. They are interesting, not causation. And be really careful with automatically assuming that every scientific study is wrong because there could be some benefit to a pharmaceutical company. That's capitalism. So take care.